So the cumulative effect in the long run of these continuous spikes in your blood sugar without insulin doing its job to reduce the blood sugar is what is called insulin resistance, meaning your cells become dormant to the presence of insulin in your blood. So insulin is actually produced, but your cells don't react to it anymore. So the blood sugar remains so high, and this is a state called insulin resistance. When this happens, the body looks for alternative mechanisms to get rid of that excess sugar in your bloodstream. One of them is which the body converts the sugar into fat and is stored. Now, where the fat is stored matters. Your body can decide to store that excess sugar as fat around your visceral region, which is around your organs of the abdomen. For example, around your liver, around your pancreas, around your intestines. That is called visceral fat. And most of the time, this is going to be manifested as bulging of the stomach. You realize that probably you start developing a pot belly, you start gaining weight, especially if the fat is now stored as subcutaneous fat. You start gaining weight generally. Most of the time, the first indication is you start gaining abdominal weight. And that's why it is very dangerous to have a pot belly or to have a big belly, because it's already a risk factor. It's already your body signaling to you that fat is being stored in the wrong places. All right. So if you measure your abdominal circumference for a man, it shouldn't be greater than 102 centimeters, and for a woman, it shouldn't be greater than 80. If it is, then you probably have what we call abdominal obesity or android obesity, which is a risk factor for chronic diseases, diabetes inclusive. Now, another dangerous area where this excess sugar can be stored as fat is actually in your liver cells. If your liver starts storing the excess sugar as fat, in the long run, it's going to cause chronic inflammation in the liver and you can develop what we call fatty liver disease, non-alcoholic fatty liver disease, which is a growing epidemic in my field. In gastroenterology, we are discovering more and more people in all age groups, including children, who are having fat in their liver, but they don't drink alcohol because in the past, the first cause of fat in the liver was as a result of alcohol. But that's no longer the case now. Including alcohol, now there is also overconsumption of sugar or ultra-processed foods, like the ones you have listed earlier. So you see, this cumulative effect is what we call insulin resistance, and this can take years. So the fact that you do your diabetes test, for example, you do your fasting blood sugar and it's normal within the normal ranges, or you do your HbA1c, which is actually a test tool to screen you for diabetes, and it's normal, it doesn't mean that you are out of the risky zone. As long as you have abdominal obesity and you don't eat right, you consume lots and lots of ultra-processed foods with added sugars, you are actually at risk, because insulin resistance doesn't exactly manifest with symptoms. The highest you may see is just that probably a few hours after eating, you have like brain fog, you are fatigued, you're tired again, and you're craving for more sugar or you want to eat more. It's important to note that these things don't happen in one day or 1 year. All right, it can take even up to 10 years for this to establish before your body finally gives way, and then you do a test and we confirm you diabetic. But before that, your body will be giving you some signals. All right, some symptoms and signs may include generalized fatigue. You're always tired even without doing any strenuous physical activity. You're always tired. Sometimes it might manifest as excessive appetite. You keep eating and you're never getting full. After a few hours, you just want to eat again. That's medically called polyphagia. And you might be urinating in large quantities several times a day. And usually the trick is you will see ants. If you urinate probably in open air or where ants can have access to your urine, you always see ants coming around your urine because there is actually sugar in that urine. So you see ants coming there to feed. And sometimes you might have sleep problems, unable to sleep, you're always feeling stressed, you're unable to focus. There's this brain fog, especially after eating. You can't focus, you can't think clearly. And sometimes when you have a small wound on your skin, it takes a very long time to heal. All these things are signs and symptoms of diabetes. You should probably go and get checked if you notice yourself having this kind of symptoms. And sometimes you might be asymptomatic, but you discover that you're gaining weight more than you used to. You're gaining weight rapidly, or you're gaining weight in some particular places like your abdomen. Now, coming to the gastrointestinal system, this insulin resistance or high blood sugars for over long periods of time will cause inflammation in your gut, because excessive sugar actually feeds the bad bacteria in your intestines, because your intestines contains millions, in fact trillions of bacteria. Some are good, some are bad. What sugar does, what excessive sugar does, and what this state of high blood glucose does is that it feeds the bad bacteria in your gut, and it can manifest as abdominal pain, and sometimes you might have problems digesting your food. All right, you eat and it's like the food is not going down, it's like it's just standing. You have this uncomfortable feeling around your chest, which is sometimes as a result of diabetes already affecting the nerves of your gastrointestinal tract. So sometimes indigestion is not just a gastrointestinal problem, it's actually a metabolic problem as a result of diabetes. The news here is that it's reversible, all right? Especially if you are not yet diabetic. But even diabetics can get into a state of remission where the blood glucose remains acceptably low. And this is when you have to make a lot of lifestyle modifications, including reducing the amount of sugar or carbohydrate dense meals you take. So dieting is an essential part in the management of diabetes, as well as physical exercise. Make it a habit to exercise every day. You must not do strenuous exercise, but you can do brisk walking, that is walking fast for at least 30 minutes every day, and walking after every meal, maybe for 10 to 15 minutes after every meal. Another very important aspect in the prevention and treatment of diabetes is intermittent fasting. We cannot underestimate the power of fasting, especially in a world today where people can barely go 2 hours without snacking on something. This consistent eating is what keeps our blood glucose levels very high and our insulin levels very high, which keep us in a pre-diabetic or a diabetic state with consistent inflammation affecting all organs in our bodies. So when you fast, you actually give your body room to rest, and you give your body room to tap into the excessive stores of both glucose or fats, and bring down as well the high insulin levels in your bloodstream. So fasting is a very pertinent aspect of prevention and treatment when it comes to diabetes. Now, last but not the least, rest. Rest is vital, all right? Excessive stress can cause a lot of hormonal imbalances and can worsen insulin resistance. That said, I hope this video helped you in one way or the other, and I hope that it's going to encourage you to live a better life, live a healthier life, and prevent things that could affect you in the long run. Let's eat right and let's fight diabetes together. Excessive sugar intake is the enemy here. Thanks for watching.